For now on the healthcare fight, we turn to our Nancy Cordes on Capitol Hill. Nancy, we've heard some Republican organizations come out against this whole entire bill. What's the temperature on Capitol Hill with this bill right now?
It's pretty intense. You know, when you've got the Club for Growth, Heritage Foundation, and Freedom Works, three big, influential conservative groups all coming out and saying this is just Obamacare-lite, this is a warmed-over replacement for Obamacare, we want to see a full repeal, that's not what this is, then you know you've got a lot of work to do if you're a Republican leader, because there are a lot of conservative members here on Capitol Hill who pay a lot of attention to what those groups say, who coordinate with those groups, and you're hearing the same kinds of things from conservative lawmakers on Capitol Hill who have been arguing all along, hey, let's just scrap the entire Obamacare legislation first. Let's go back to ground zero and then build from there. That is not what this plan does. Republican leaders say that's just unworkable. You'd throw millions of people off of their insurance plans. You'd create chaos in the insurance industry. So they've gone a different direction. But the question is whether they can massage this bill, make changes to make enough conservatives happy with the plan that they'll come on board and vote yes.
We still don't know, Nancy, exactly how much this is going to cost. I'm curious if you've heard from any of the insurance companies. Have they reacted to this plan?
Not only do we not know how much it's going to cost, we don't even know how Republican leaders plan to pay for this law. You know, they want to do away with all of the taxes that were part of Obamacare, that were used to pay for the tax credits and subsidies that were part of Obamacare. So there were taxes on medical device manufacturers and on pharmaceutical companies and on wealthy individuals who had high dollar insurance plans. All of those taxes go away, at least in the short term. So the question becomes, well, how are you planning to pay for all of these tax credits? And you don't get a very satisfactory answer from the authors of the plan. Listen to this. This is what it says on the website that's been set up for this new health care bill. Quote, we are still discussing details, but we are committed to repealing Obamacare and replacing it with fiscally responsible policies that restore the free market and protect taxpayers. So that is one of the big problems here, is that Republican leaders are trying to get people on board, but they haven't given them some of the basic information that conservatives and frankly all lawmakers would need in order to know whether they support this plan. Obviously, it's going to make a huge difference to lawmakers whether this plan is paid for, how much it costs, and how you're going to pay for it.
You talk about the things right now, Nancy, that the GOP leaders just can't get behind, but I'm curious, what do they want to see in a bill that can actually get them to back something and change in Obamacare?
You're talking about conservative lawmakers?
Yes. Mm-hmm.
Well, first of all, they really don't like this idea of refundable tax credits, because they believe that that essentially amounts to a new entitlement that would be created on the GOP's watch. They say we are anti-entitlement. We are the party of fewer entitlements. We are the party of making people pull themselves up by their own bootstraps. We're not the party of handouts. And so when you've got these tax credits that initially in an earlier draft were going to be across the board to all Americans, which these conservatives thought was bad enough, but now they're only targeted to low and middle income Americans. They're refundable, which means even if people don't pay taxes, they still get that money. And so conservatives don't like that, number one. Number two, they don't like the fact that the bill does not do much until 2020 to rein in the growth of Medicaid under Obamacare. And even then, they start to cut it back very slightly. Interestingly, this is something that was demanded by a number of more moderate Republicans who said you can't leave these governors in the lurch, Republican and Democratic governors alike, who have expanded Medicaid in their states, and now you're saying you're going to drop people off the rolls. You can't do that. So they pushed off any cuts to Medicaid, but in the process they are angering conservatives. And then the final thing that they are very troubled by in this bill is that it has done away with the individual mandate and the employer mandate, requiring people to buy insurance and requiring employers to cover their workers. Instead, the way that this bill tries to get people to keep insurance is to tell insurance companies that if someone lets their insurance lapse for a certain period of time, you can charge them a 30% premium for them to get back onto insurance coverage. And that's kind of the way that this bill deals with the fact that they don't just want people who are sick getting insurance, they want to encourage people who are healthy to get insurance as well. Well, you've got folks like Republican Rand Paul already saying today he doesn't even think that that's constitutional. He says basically what you're doing is instead of the government collecting the penalty, now you're allowing the insurance companies to collect this big penalty instead. So you can start to see the huge clash that is shaping up, even as Republican leaders try to steamroll they want to hold votes as early as the end of this week. They want to move as quickly as possible on this plan, but there's still a lot of people with a lot of problems.
You're so right, Nancy. This battle is only beginning. Nancy Cordes on Capitol Hill. Thank you so much.
You're welcome.